Your foot falls asleep and 1,000 tiny needles attack. Here's the twist. It's not your blood. That tingling is a brief nerve reboot, and it usually means your body is protecting itself. Most pins and needles start after holding a posture that presses on a peripheral nerve. Crossed legs, leaning on an elbow, or sleeping on an arm can do it in minutes. People blame lost circulation to the whole limb, but the main issue is local nerve compression. Pressure also squeezes the nerve's tiny blood supply, yet the key failure is signal conduction along the nerve. Under pressure, the nerve's insulation and ion channels misbehave, and normal messages slow or stop reaching the brain. That numb, heavy feeling has a name: temporary conduction block, the mildest, reversible kind of nerve injury. When you shift and take the pressure off, blood flow and nerve excitability rebound within the compressed spot. Now the freshly reawakened sensory fibers are jumpy and start firing together instead of in their usual order. Your brain reads that chaotic burst as tingling or pins and needles, a prompt to move before damage builds. In ordinary posture cases, the feeling fades within minutes once you take weight off and start moving. Treat the first hint of numbness as a friendly nudge. Shift, uncross, or roll off the pressure point. That small move protects the nerve from prolonged compression, letting normal signaling settle back in. You'll feel it most in arms, hands, legs, or feet, places we bend, lean on, or rest weight without noticing. Hard chair edges or a strap can press one spot long enough to irritate a nerve and start the sequence. First comes the numb phase. The limb feels asleep because normal messages aren't getting through. Then comes the tingling phase. Mixed signals arrive together until orderly traffic returns. We're describing posture pressure on a nerve trunk. At a spinal nerve root, tingling can appear during compression and ease after. Different anatomy, same principle. Disturbed signaling that improves when compression is relieved. If tingling keeps recurring, lingers, or shows up with weakness or changes in speech or vision, seek medical care. Typical posture cases are brief and self-resolving. Persistent or paired symptoms can indicate something else. Best habit: change position early, then move gently so signal traffic returns to its usual pattern. Think of pins and needles as a short-lived reboot after local pressure, guiding you to protect the nerve. A nerve is a living cable, bundled fibers with insulation and tiny vessels that keep it working. Focused pressure distorts the sheath and pinches those microvessels, making signal flow unreliable until relief. Small, hard edges concentrate force on a tiny area, so the same weight creates higher pressure there. That's why desk elbows, chair rims, and tight straps often irritate one spot long enough to spark tingling. After pressure lifts, gentle movement alternates load and boosts perfusion, clearing the temporary ion mess along the nerve. As gradients reset, fibers quiet down and orderly messages reclaim the line, so the feeling eases. During the reboot window, sensations can be tingly, prickly, or buzzy as mixed signals arrive together. The flavor and intensity depend on how long and how firmly the spot was compressed. Prevent compression. Change angles often, cushion sharp edges, and share weight across more surface. Build micromoves into still tasks, so nerves never sit under one point long enough to go quiet. If a position causes numbness that settles after moving, it's likely a brief compression effect, not an emergency. Keep listening for early hints and move kindly. Most posture cases resolve within minutes once pressure lifts. Many nerves travel near skin over firm edges at joints, where small areas bear lots of force. Those shallow routes are prime pinch zones, so posture can briefly scramble signaling until pressure eases. Pressing the bony side of a bent knee can send tingles down the leg from that single spot. Uncrossing spreads load across more tissue, dropping local pressure and letting signals organize again. Leaning long on a bent elbow can spark tingling down the forearm and into parts of the hand. A softer surface or straighter angle reduces focal pressure on the nerve bundle at that corner. Only a patch tingles because you're exciting one branch, not the whole limb's wiring at once. The pattern you feel roughly traces where that branch carries touch signals back toward your brain. Tingling comes from sensory fibers misfiring together. Motor fibers move muscles and shouldn't feel weak from brief pressure. If weakness appears or lingers, that's beyond ordinary posture tingling and deserves medical attention. Map shallow routes, ease pressure early, move gently, and read patchy tingles as a brief reboot. Not a crisis. That mindset turns an odd sensation into useful feedback you can act on during normal life. There are names for the two phases. The numb spell is often called obdurmission. The tingling on return is paresthesia, a brief abnormal sensation as orderly signaling comes back online. This fits the mildest nerve injury pattern. Neuropraxia, a reversible conduction block from local compression. It improves quickly once pressure lifts, unlike structural damage that needs time or treatment to heal. It fades in minutes because tiny vessels reopen and membrane channels recover, shrinking spontaneous firing. As the nerve's baseline excitability resets, normal sensations replace the noisy burst. Sleep can set the trap. An arm tucked under a pillow keeps steady weight on one small area. A more neutral, supported angle spares that branch from continuous squeeze while you rest. Gentle motion invites order back. Aggressive shaking or pounding isn't needed and can irritate tissues. Think smooth, low-effort movement that restores flow without creating new pressure points. Quick story. Posture compresses a nerve, signals drop, release triggers noisy return, then calm follows. Use it as information, not panic. Stay alert to weakness or persistent changes which warrant attention. Nerves run long routes and wrap around firm corners, so a tiny area can carry a lot of your weight. That geometry explains why everyday positions sometimes disturb signaling from just one small site. Each nerve carries its own tiny blood supply. Pressure can narrow those vessels and muddle conduction locally. Relieving that spot restores perfusion and excitability, so orderly messages can take over again. Right after relief, sensory fibers fire out of sync, which your brain reads as tingles and prickles. As membrane behavior steadies, the random bursts fade and regular touch information dominates again. The limb isn't starved of blood. The issue is a pressured nerve segment and its tiny vessels misbehaving. Change position, restore local flow, and the system reverts from static to signal within minutes. Simple routine. Take weight off, try light movement, and notice sensations settle in short order in typical cases. Use earlier red flags as your boundary if tingling persists or pairs with other neurological changes. Hands, feet, and elbows each have unique pinch-prone paths, so patterns vary with the route that's compressed. Knowing that variety keeps the story simple. Local pressure, brief reboot, then usual signaling returns. At the wrist and palm, a hard edge or handle can focus weight onto a tiny stretch of the nerve's route. Rotate grips, add a soft surface, and keep the wrist nearer straight to share force before signals misbehave. Under the thigh or around the ankle, a chair rim or tucked feet can load one small segment long enough to confuse signals. Slide forward, uncross or untuck, and use cushion to spread load so sensation stays ordinary. A heavy shoulder strap can press on a narrow spot along the path toward the arm and spark odd sensations nearby. Lighten the load, swap sides regularly, or add padding so no single point takes the burden. After you unweight, a short fizz can linger while membranes finish settling and local circulation normalizes. Give it calm seconds of easy motion. Relief, not force, closes the loop in typical posture episodes. Treat the sensation as position feedback, a timely message to move before compression accumulates. Acting on that message quickly turns scattered signals back into normal touch and position information. Here's a shareable line. Posture squashes a nerve, movement wakes it noisily, gentle motion restores clarity. Pass it along. This simple framing shrinks worry and encourages earlier, kinder position changes. Run a quick self-check. Relieve pressure, move lightly, and notice whether strength and coordination feel normal. If it settles in minutes and strength is fine, it's likely posture-related. Persistence or new weakness deserves medical care. Make prevention automatic. Tie small posture shifts to routine cues. Messages, stretch breaks, or sips of water. These micro-adjustments stop any one spot from bearing weight long enough to quiet a nerve. Use a traceback test. The tingling patch hints which contact point was loaded a moment ago. Change that contact, retest gently, and confirm the fix when normal sensation returns promptly. Drop the old phrase, "The nerve went quiet under pressure," then rebooted with noisy signals on release. Read that noise as an early warning to unweight, not as blood loss to your entire limb. Remember 3 words: unweight, wiggle, watch, the calm routine that lets orderly sensation return. Teach that tiny mantra and most everyday zaps become quick course corrections instead of worries. You now have a map, a reason, and a routine. Position feedback protects nerves in everyday life. Use it the next time you feel a fizz. One crisp takeaway ties the whole story together. Pins and needles is a brief nerve reboot from local pressure. A built-in nudge to change position, not whole limb blood loss. Ease the pressure and move lightly. Ordinary cases settle quickly. New weakness or ongoing changes warrant medical attention. If this demystified that zing, share the rule and subscribe for more clear, everyday body explainers. Comment with the next sensation you're curious about, and we'll unpack the science. Calm, careful, and useful.